Broadcasting from the business capital of the world, this is the Podcast Business News Network. Dr. Robin Cannazzaro joins us here live today as a holistic coach at Wholistic Veterinary Care. Excited to have her here. She's on a mission to educate people to the power of all forms of natural healing, to empower them in natural health for themselves as well as their pets. So, welcome to the show today. How are you?
I'm doing just fine, thank you. Just trying to survive this sizzling heat.
And you're in Florida, right? Where
Yes,
specifically?
yes. I'm in Brooksville, Florida, just a little bit north of Tampa, Florida.
Beautiful. Well,
Yeah.
we're excited to have you here. Would you mind telling us a little bit about what holistic vet care is all about?
Sure. I am a homeopathic, holistic veterinarian, and holistic medicine is an umbrella that basically covers all forms of natural medicine. So that could include acupuncture, Chinese medicine, homeopathic medicine, spinal adjusting, body work, massage therapy, etc. And most of what I do is homeopathic medicine. And I also do some traditional Chinese medicine and acupuncture, but homeopathic medicine
Wow.
is more my passion.
Great. Well, I before we talk more about the work you're doing, and I want to urge everyone to go to the website. It's Holistic Vet Care. So that's WHOLISTICVETCARE.com. Could you start off by telling us a little bit about where you grew up and give us a little backstory about, how little Robin became Dr. Cannizzaro and, tell us a little bit about who inspired you into this field and yeah, your love of animals, clearly.
I have, I guess, sort of an interesting past, but I grew up on 5 acre farm with my family in Fairfield, Connecticut. And I was always a major horse enthusiast. And I was very interested in the form and balance of the hoof of the horse. So I studied that a lot on my own. And I was very interested in being involved with animals. But at my age, I guess I'm telling my age here a bit, but at my age, I was told by the local equine veterinarians, oh, women don't get into vet school. And if they do, they have to have straight A's, etc. So I just wasn't sure what to do. Went to college and I majored in anthropology and sociology. And while I liked the field an awful lot, there wasn't anything in particular I wanted to do with it career wise. And I just had the most amazing um, uh, guide. And basically she was my counselor for my major, my dual major. And she said, well, what do you want to do? And I said, well, I always wanted to be a vet, but women don't get into vet school. She said, oh, you could do anything you want. You could be the president of the United States if you wanted to be. So I decided to go for it. And I did get into veterinary school. It was very shortly after I graduated that I discovered that traditional medicine just didn't seem to solve the problems with animals that I had expected and or that I was taught. And so I sought some additional answers, got basically certified and trained in traditional Chinese medicine and acupuncture, and then trained and certified in homeopathic veterinary medicine through Dr. Richard Pitcairn. And then I went on to study with some others, human homeopaths as well as veterinary homeopaths in the field. And it just seemed like when I took the homeopathic coursework that I just kind of came home, and that home felt really good to me. So it is primarily what I do, and I absolutely love it. I can help more animals. In the beginning in veterinary medicine,
Yeah.
I just kept treating the same problems over and over again, and the same problems would come back again over and over again. And I felt like there just has to be a better way. So I feel really grateful and blessed that I was open minded enough to really search for some better answers. So my experience has been that homeopathic medicine can treat and heal the majority of ailments in animals, and same would be true of people as well.
Oh, wow. Who do you credit to, inspiring you to go to school for this? And did you have a mentor? Did you have someone that you looked up to specifically?
Um, it was when I was in college at Sweetbriar College, a women's college in Virginia. It was Catherine Siemens that was the one that really encouraged me to pursue my dreams. She's the person that really stands out the most. I wouldn't say that there's a particular veterinarian that did. And after I had graduated from college, I did move to Florida, and I did take a position with Christopher Wilcox, an MD, and working in some research in renovascular
Hmm.
hypertension. And he was incredibly encouraging in helping me to really discover more of my potential and really encourage me to go for it as well in terms of going to veterinary school. And he had offered me some challenges that if I met those challenges, I could co-author some papers that he on research that he was working on that I was assisting in. And so it was, I encountered people along the way, those two in particular, that were professionals that, really lifted me up. And it isn't every day that
Yeah.
somebody lifts you up. And I'm super grateful for those people. Otherwise, I think I would have stayed in a more meager existence and maybe not reached for what my dreams really are, or really
Oh,
were at the time and still are.
all right. Well, let's break it down now, the work that you're doing. So, are you strictly working with those in Florida? Do you do virtual work to those all over?
I do both. I have clients inside and outside of Florida. And so I do offer telemedicine consults. And it's hard. There's probably only about 1,000 homeopathic veterinarians in the country, I'm guessing, but truly not very many. Of course, there's veterinarians on every corner, but those are traditional veterinary practices. So I do both. I have clients all over the state of Florida and outside of Florida, all over the US, and occasional client from, I do have a few clients from Canada and rarely from outside of the country. I have a few.
Awesome. And what are some of the types of things people are coming to you with specifically for their animals that maybe a regular veterinarian cannot do?
Well, there's a lot that traditional veterinary medicine can't do. I see everything from puppies, kittens, foals, to elderly patients. There's no bad place to start. Obviously, if we can start at a young age, that would be better. There is nothing that homeopathic medicine can't treat and treat better at any stage or age.
Mhm.
But some of the cases that I get are really sad. They're cases where the traditional veterinarian has given up and said there's nothing more that can be done, or keep giving these drugs and medications that
Mhm.
have their own diseases associated with them. And they end up coming to me, and in most cases, they end up actually improving. Some cases quite a lot. Some animals will live much longer than expected. Some
Yeah.
of them will have a much better quality of life for the time they have remaining. The one key thing is they're not going to have the diseases associated with the drugs,
Hmm.
because the type of medications that I use have no side effects. No, they're in no way dangerous. They either help or they don't. And, if we can think outside of the box, there's an awful lot that we can do with natural medicine to relieve suffering in animals. And really, that's what I signed up for when I went to veterinary school. Above all, do no harm, and, to be healing animals. And just using drug therapy and covering band-aids up of symptoms isn't healing animals. It's kind of just working from one crisis to the next. And that's really not what I signed up for. That's not what,
Yeah.
my maybe ignorant idea of veterinary medicine was, until I learned how to do things differently and better.
Interesting. I love it. This is great because I have three cats. I'm an animal lover myself. Like I said, I know you have horses. I saw, by the way, the pictures on your website. Are those your horses? Like, are those yours?
Yes, yeah, they
Oh,
are. I do have some pictures of clients' animals on my site, but I do have lots on there that are my horses. I'm sure that one of the horses on there is who I call my blonde boyfriend, and that's my big Palomino warm blood, and he is just the apple of my eye. And his name is
oh.
Barbados.
Oh my goodness, beautiful. And then
Yeah.
I know I also notice on the website you also do the pharmaceutical supplies, nutritional supplements. Can you share a little bit about this?
Sure. I am trying to keep up with the ages, and I'm a little bit slow, but I wanted to be able to provide pharmaceutical, access, especially for clients that need fluid therapy, I teach my clients how to do subcutaneous fluids under the skin for cats with chronic kidney disease, or dogs with chronic kidney disease, or animals that have illnesses for which they don't need to go into the hospital, but we might be able to manage and help them at home, maybe elderly animals that get a little bit dehydrated and need the extra boost. Heartworm prevention. Some of my clients choose to use heartworm prevention here in Florida and outside of Florida, and some choose not to. It's a way in which they're able to access those medications without necessarily having to come into the office. So I am trying to move into this century, I swear, really. And then the nutraceuticals, for me, are really kind of an assistant to the homeopathic treatment that I am offering. So that helps in certain circumstances where animals need a little extra support. And it also might help lessen some symptoms in the time it might be taking for the animal to be healing with homeopathic medicine. So I'm a big believer in, natural, whole food, species appropriate diets and supplements when and where needed, as well as homeopathic treatment for whatever ails them.
Beautiful. And you can order from the website to any state you ship to.
Well, it's supposed to be within the same state.
Oh, okay.
So unfortunately, we're not really supposed to sell medications over
Mm-hmm.
lines. But as far as supplements, to my knowledge, I don't believe that's any difficulty to order supplements across state lines. It just would be any pharmaceutical medications are supposed to be within the state of Florida that I'm licensed in.
Perfect. All right. Thank you so much. I'm looking at the food. I'm looking at the treats. I'm looking at everything right now as we speak too in the corner here, the
Oh,
screen.
you're going to have fun shopping.
Oh my goodness. Yay. And
Enjoy
let's talk.
shopping.
Oh, see, I'm clicking the computer too hard looking at your stuff. I just dropped
Yeah.
my camera. And it's not staying. All right, so hold on. Let's fix that. There we go. So you mentioned helping you and your pet enjoy a long, healthy life together. Tell me what the effect of, pet owners and people since the pandemic, how did that affect our animals too? It's not just us, right?
No, it really isn't. I mean, the pandemic was tremendously difficult. In some respects, it was a little bit better for animals. In some respects, it wasn't. Just in that, depending on where you live, if there was shutdown, people were working from home, and that was kind of nice for their animals. But of course, people under greater stress, that also can be stressful for animals. We live in the same energy space together. And so, whatever we are afflicted with or whatever stressors we might have, there's a chance that that could be affecting depending
Yeah.
on the level of sensitivity of the pet. I stayed open during the pandemic. Of course, we were essential work. We were essential providers, so we were entitled to do that. And I did allow people to come into my office if they were willing to wear a mask. And my office is very small. I'm actually sitting in it, and it's actually a sunroom attached to the side of my home. So I get to see all the wildlife while I'm working, whether it's
Mm-hmm.
by telemedicine, Zoom, or whether it is in person. And the cats love it because they can see all the lizards climbing on the windows. You can't
Aw.
see that because I don't really have a window behind me except a door to the house. But anyway, so I think that the pandemic had a mixed bag. When people had to go to the veterinarian and they had to stay in their cars and their pets were taken in, I think that was very stressful for the animals and it was very stressful for people. They really didn't. My experience is that clients just didn't have a sense of having much control over what was going to happen to their pet when they went into the vet office without them in attendance. And some things didn't go very well, when that happened. And I think that was incredibly stressful for people. And it does bring up really another topic that I think since the pandemic, it's been a little challenging. I think people have been had a little change and have been a little rougher to veterinarians since then, being a little more, defensive or agitated about veterinary visits from the experiences that they've had. So being on some of the sites, the social sites I am with other veterinarians and hearing their experiences of, being beat up and battered verbally by clients, I guess it just kind of surprised me, but maybe not an awful lot. And I know it's taken a real toll in the veterinary profession. And some young veterinarians are leaving the profession as a result, which is really sad because, like many professions, I think there's a shortage. and of veterinarians, period. I don't think I experienced that as much because the type of medicine that I do is really
Mm-hmm.
different. And the type of medicine I do is really very interactive with the client and relies upon my client to give me feedback and work with me toward well care for their pet. It's a little different than just being handed an antibiotic and go out the door, or a pill, a vial of steroids and go out the door, or whatever. That is a little less personal, a little less interactive. So I really consider the type of work I do to be a partnership in well care, because without the information and participation of the client, then the pet would not get better. So it's really necessary to have kind of a nice open dialogue.
Beautiful. Well, what else did you want to make sure we cover for today, being it is your first 30-minute show with us. Would love to hear some more examples of the people you're helping and, why you're so passionate about this job.
I'm really blessed to do what I love. And I think once I had come home and found homeopathic medicine, it just entirely spoke to me, because I was always looking for, how do we actually treat the underlying imbalance of chronic diseases, or any diseases, or acute diseases. And most of the diseases we see in veterinary medicine are chronic diseases.
Mm-hmm.
And what they have is a component of an acute exacerbation of chronic disease, which makes it look like an acute disease.
Yeah.
The animal suddenly having diarrhea, but they have a history of diarrhea, or they have history of diarrhea in the past before. And medication might appear as if it makes it go away, but then it
Yeah.
keeps coming back again and again and again. So getting to the root causes and getting to the underlying imbalance is incredibly rewarding, because we get to see the animals flourish in a way that they've
Mm-hmm.
never flourished in traditional medicine. And I'm not saying my colleagues are doing a terrible job out there. It's just limited. It's incredibly limited. And I really think that drawing that kind of contrast is important,
Yeah.
because there are so few homeopathic veterinarians. And I think it's important to connect with one, even if you have to work remotely, because the difference can be phenomenal. The difference can be absolutely life-changing for that animal, and for the person. I mean, let's face it, they are our fur children for most of my clients anyway. And I imagine you feel that way about your cats, or hope so anyway.
Yes,
So,
of course, of course. And my
and
kids.
yeah, I mean, and it's fun to watch
Yeah.
them flourish, and it's so rewarding to watch them flourish. And when we can treat the underlying imbalance of chronic disease, then the client can see their pet actually improve for the first time, not only with resolution of symptoms, but more energy and playing with toys again, or you know, improving performance wise if they happen to be a horse. I do large and small animals. I do exotics, I do everything. So there's nothing I haven't worked with, even wildlife. So it's amazing to see them flourish, to be able to flourish sometimes faster, some faster than others, and in ways in which that people did not expect or never experienced in traditional medicine.
Love it. I love hearing this. And, it's so funny because some people might not understand really the concept of what holistic even is. Could you just give us a little bit of the background on what holistic medicine is?
Holistic medicine is any natural modality. Like I said, it is an umbrella
Mm-hmm.
term, and it does cover any of the holistic modalities, whether you're talking about traditional Chinese medicine, or
Yep.
acupuncture, homeopathic medicine, spinal adjusting, massage therapy, nutritional therapy, nutraceuticals. Virtually any natural form of medicine is covered under holistic medicine. And one distinction I think is incredibly important to make is that there are a lot of veterinarians kind of catching on that maybe holistic medicine is a good idea, but they don't
Yep.
really give up on allopathic or traditional medicine. And so what they do is they have a partially
Hmm.
holistic practice, or what's called an integrative practice. And in my opinion, it's kind of like driving with the brakes
Oh
on.
gosh.
There you
Yeah.
are, you're flying around again.
Exactly. I don't know
My
what's going on.
goodness.
I'm here. I'm here. I'm looking. It's just fine.
I know she's running around all over the place.
And I got a
My
better
goodness.
camera now, but it looks like it's
Yeah.
just not sticking as well.
Yeah, no, I think you're having a challenge there. I think they need
I
to
am.
get you some better equipment there. So basically, if you go to an integrative practice, you're really getting traditional or allopathic medicine,
Mm-hmm.
but you're also just getting a little bit of a flavor of natural medicine. But because you're not getting entirely holistic
Yep.
medicine, you're also getting drug therapy, you're driving with the brakes on. So the idea behind holistic medicine should be restoring homeostasis or balance through the use of natural medicines that don't have side effects or disease effects, because side effects is a polite name for the disease the drug causes itself. So then you have the original disease and you have the side effect or the disease the drug causes itself. And then we
Mm-hmm.
give more medication for that if it's an allopathic practice. So the primary aim of the integrative practices is
Yes,
using
yep.
allopathic medicine first, and then maybe offering a sprinkling of some holistic. There are a few holistic practitioners that might, just do acupuncture and Chinese medicine,
Mm-hmm.
or maybe just do homeopathy. My practice is unique in that I do offer blood work, urinalyses, annual checkups, heartworm tests, et cetera. Most homeopathic veterinarians don't. So my practice is a little more encompassing in that way, but I don't offer any drug therapy. So your clue whether you really are with a holistic practitioner,
Yeah.
veterinary practitioner, is whether they are calling National Dental Month, where you can bring your pet in and put them under anesthesia, which is dangerous for dental,
Mm.
unless it's a life-sustaining procedure or they have such a painful tooth that they can't eat. Then I
Yep.
could understand having an anesthetic dental. But having a, annual dental week or, 6-month dental week or,
Uh,
sale on vaccinations, or that's a clue you're not with a holistic veterinarian. So I think it's a good idea for any listeners to really understand if they want integrative medicine, which is really traditional medicine with a little sprinkling
mm-hmm.
of holistic. That's fine if that's really what you're looking for. But I think it's important for people not to get misled into thinking they're going to a truly holistic practitioner,
Yes.
because that would be defined by somebody who uses no or almost no drug medicine. What I mean by that is if I do have a patient that comes to me that has seizures and they're on anticonvulsant medication, it's not as if someone like myself is going to say, well, we're just going to stop that right away. Or if they have advanced heart failure and they require heart medication in order to sustain life,
Mm-hmm.
we're not going to take those drugs away from them. If we could go to lowest possible doses, that's fine. If they need to stay on those medications, I do my
If we
best to
can't.
help them
Mm.
to achieve the best quality of life that they can have with the use of natural medicine, even if we have to sustain some medications. But we don't want to confuse that with an animal that, for instance, has a skin problem and
Yeah.
they're put on antibiotics, and you say, oh, well, that's for, so they won't suffer, or Cytopoint so they won't suffer, or Apoquil so they won't suffer. It's not like that, because those are not life-sustaining drugs. While
Yeah.
it's inconvenient and not so nice to have your pet itching and chewing all the time, those medications would not be something that you might find in a practice such as mine. I mean, I wouldn't prescribe those medications. And
Yeah.
even though we have a pharmacy link, I wouldn't approve those kinds of medications either, nor the flea and tick poisons. I don't approve those either. So even though I have a pharmacy site, it is for specific items to assist patients who might need to stay on anticonvulsant medications or might need fluid therapy, but not necessarily for, well, I think I'd like to get some antibiotics or some steroids for my pet skin, or flea or tick poisons or something of that sort.
Well, as a holistic doctor, can I just ask a question? Because there was a new law like last year just passed in New York State about like with cats about no declawing, and now other states are moving forward saying that it's inhumane. Just your take on that, because that was just in the news the other day. I think New Jersey's trying to do the same now.
Yeah, that's a really good question. I would have to say that very early in my practice, I no longer offer surgery in my practice. I haven't been performing surgery since about 2009.
Okay.
But that said, even when I was offering surgery, I did not do ear cropping. I didn't do declawing. I did when I was working at other practices, because that wasn't my decision to make. It
Mm-hmm.
is, but it isn't. When you're working for
Yeah.
somebody else, you do what they tell you to do. Otherwise, you don't keep your job. It's just that
Yes.
simple. When I started my own practice in 1996, I made a conscious decision. I just wasn't going to do tail docking and ear cropping and declawing of cats. It is cruel, and declawing is an amputation of basically the end of the finger. So if
Mm.
you think about amputating the nail and the end of your finger, that is what we are doing to cats. I understand that we all love our furniture. I guess I don't love it as much as I love my pets, but there are alternatives to that. And I do think it's cruel and inhumane to do such a thing. So, I get it that some people would like to hold on to those things, including ear cropping for the looks of however they want the animal to look. I understand those things. It's just not something that I agree with. And I
Okay.
do feel very strongly about it.
Good. Thank you for that. And we still have 2 more minutes left in your show. So what else did you want to make sure we address for us today, Doc?
I would suggest going to either to my website or to www.theavh.org.
Okay.
If you want to put that up as well. That is so that you can find a homeopathic veterinarian in your area. And I would encourage exploring that. There are some really good sources, book sources that might be of value to you. One is Natural Health for Dogs and Cats by Dr. Richard Pitcairn. And another one would be Beyond Flat Earth Medicine, written by Dr. Michael Dooley. He's an MD. And that book is all about homeopathic medicine. And it's a really easy read. It's only about 100 pages long, intended for all audiences. It just gives a really nice overview in human or veterinary medicine, doesn't matter because it works the
Okay.
same in both. And I would encourage people to explore that. And I hope that this has been really useful.
Agree. I think it has. Tell us how we can reach out to you, please.
Sure. You're welcome to visit my website at www.wholisticvetcare.com, spelled with a W in the front.
Got it.
Or my phone number is 352-796-2648. So please feel free to contact my office if you would like additional information. And like I said, I do some virtual medicine as well as anywhere in the state of Florida and outside of Florida. So feel
Perfect.
free. I hope to be able to educate as many people as possible so you have more choices available to you.
Beautiful. Thank you again for being here, for joining us, and
My
looking
pleasure.
forward to the next time we connect. Have a great weekend.
Thank you so much. I appreciate it. You have a fantastic day. And be well, be healthy. Bye now.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.